Hey parents, one of the most unexpected events from labor is actually after birth, and it's the fundal massage. I'm dedicating a whole video to it because so many women, myself included, wish they knew about it before they experienced it after labor and birth. I'm Bridget, and I'm a childbirth educator, birth doula, and a mama, and if you're new here, make sure you subscribe and hit the little bell so you don't miss any future videos that come your way. So what is a fundal massage? A fundal massage is typically given by a doctor, a nurse, or a midwife after the birth of both baby and the placenta by using their hands to firmly rub on your tummy near the belly button, which is where the top of your uterus, the fundus, should be after giving birth. This is done to help encourage the uterus to contract to prevent excessive bleeding and make sure it's starting to shrink down to its pre-pregnancy size. Now, this massage is not very comfortable, and depending on your rate of bleeding, might need to happen more frequently after birth till the bleeding is controlled. And other forms of management may be used, such as synthetic oxytocin, to help control that bleeding. I talk all about postpartum hemorrhaging in this video up here that you can check out for yourself. So for the fundal massage, someone on your care team will press and rub in a downward motion, almost like they are trying to push something out of your vagina, which they're not doing. It just sort of feels that way. Now, my first experience after giving birth in the hospital was that the fundal massage was really painful, and this is a common experience amongst moms. However, my second experience when I gave birth with a midwife in my home was much different. I was bracing myself for a pretty intense massage when my midwife performed it still firmly, but not painfully. It wasn't comfortable, but it also wasn't unbearable. So while fundal massages can potentially be life-saving in the event of a postpartum hemorrhage, it's also important that your care team takes into consideration your comfort and your voice. Any kind of fundal massage isn't going to necessarily be comfortable because essentially you have someone kneading out a really sore and tired muscle. It'd be like massaging any other muscle that you've just overworked. But you can also request that your care team does it gently but still effectively, and I can tell you firsthand that it's possible because I've experienced both. The good thing about fundal massages is that they don't last long, and if you continue using your de-stressor breath that you learn all about in this video up here that has carried you all throughout your surges and labor, you will be able to manage the intense sensations from that fundal massage as well. Fundal massages are just a drop in the bucket of labor and birth, and if you're feeling lost when it comes to preparing for an empowering birth experience, I encourage you to take the Built to Birth online class that gives you the foundational building blocks for a happier, healthier, and easier birth and postpartum experience. If you want to learn more but you're not ready to commit to the full course, you can always take the free mini birth class for the 5 tips on how to have a positive birth. And last but not least, if you're a mama who has ever had a fundal massage before, comment your experience down below and offer some tips for a soon-to-be mama on how to make their own experience or even your next one more empowering and comfortable. Bye, mamas.